Hello and welcome to another edition of Health in the Heartland, a program dedicated to the health issues that affect you. I'm Karen Blakelock, and joining me this episode is Vincent Cole, Director of Managed Care with Hardin Memorial Health. Thanks for being here, Vincent.
Thank you.
We're going to talk a little bit about enrollment, especially today we're really focusing on Medicare and those individuals and Medicare Advantage. Is that right?
Correct. This time of year, people that have Medicare have a choice to either stay with Medicare or get on a Medicare Advantage until December 7th of this year.
So tell us a little bit about the difference between the traditional, maybe Medicare and Medicare Advantage, and what that might mean to our viewers as they look at these options.
Well, I think a lot of people know what Medicare is. That's your traditional plan where you pay your Part B premiums, and then you can buy a supplemental insurance and then also a Part D plan. And that's what typically people know as Medicare. In recent years, there's been, they've let commercial insurances offer these plans, and now they call them a Medicare Advantage plan, and they offer them once a year, and it replaces Medicare, which is a little bit confusing.
Mm-hmm. Now, I was thinking too, you know, as you're saying this, what age group does this actually affect? I mean, this isn't our whole population, so.
Typically, it's people over 65, but there are people under 65 on disability that do have Medicare. But yes, it's typically the senior population.
So I know when you look at your health plan, usually, you know, you look at going to the doctor for your visits, your possible coverage for, you know, going into the hospital, and then formularies. So what are some things that key things that they should look for, and specifically maybe the medication component of it, because if you are on medications, you want to make sure that those are covered.
Yeah, there's several things there. When you pick if you want to choose a Medicare Advantage plan, you do need to make sure that if you're going to current doctors and specialists, they'll accept that, because some don't. They're not participating with them. So that's the first thing you need to do, is make sure they're participating. See what kind of network, meaning a network of physicians, specialists, and hospitals and other caregivers. If they don't have much of a network, you're going to be very limited, and you might have to go to providers who aren't in the network, and that's going to up your out-of-pocket, and that's going to cost you. Yes, you have to be careful when you pick one. They may make you pick a primary care physician, and you want to make sure it's yours that you're currently going to. So there's several choices you have to make there. Also with Medicare Part D, what we've been talking about is Medicare Part C, and that is the replacement of Medicare. Medicare Part D is a relatively new product offered by the government for drug coverage. Most of these Medicare plans will cover your drugs, but some don't, and you have to also pick a Part D coverage. The three things I'd really say about Part D plans is, one, make sure that you look at the drugs you're currently taking and make sure the Medicare Part D coverage has those drugs on their formulary. And a formulary is just a list of drugs they will cover and they will pay for. And that sometimes is a big pitfall, because you think when you buy it that all your drugs are included on that, and they're not. I'd say that's number one. Number two is check the copays on your drugs to make sure they don't vary across plans, because sometimes that can surprise people, and there's a large copay on one of their drugs. And third is, if you're familiar with Medicare Advantage and you're already in a plan, be careful. That formulary can change from year to year, and one year your drug's on and the next year it's not. So don't assume that your drugs continue to be on their formulary, because sometimes they drop and add drugs.
Those are great points, and we really talk about being a wise healthcare consumer as we have, through all our episodes. So they really want to get their list of their medications out, maybe do some double checking between that and then also the program that they're looking at, and making sure again that they're covered. And then you said that can change, so keep up to date with it and ask questions. What about now we talked about a primary physician, what about going to a specialist? Do they need to look into that too, if they're a person that might have chronic illness, or you don't know down the road if that's going to happen to you? Do they need to ask those questions?
Yes, because in some Medicare Advantage plans, just like with commercial plans, if you're in an HMO Medicare Advantage plan, most likely you have to get approval from your primary care physician to go to a specialist. Some Medicare Advantage plans like PPO don't require that, but obviously you're going to pay more for not having to be restricted. So typically in those plans with an HMO, you're going to pay less, but you have restriction of how you get to other providers. And in a PPO environment, you're probably going to pay a higher premium, but you have more freedom to go where you want to.
And when we talk about specialists, I think, most people, you need to have your primary care physician or your family practitioner. But as you get into some diagnosis, then you either go to maybe a cardiologist or somebody that might take care of diabetes, endocrinologist, those types of big terms. Those are specialists, and you need to have sometimes a referral to go to those individuals.
Yeah, absolutely, and that's where you do want to ask those questions if you're looking at a Medicare Advantage plan, because those are the really important points. If you're not open to getting referrals for specialists and you really don't like that idea, even though it could save you money in a Medicare Advantage premium, you really want to watch out for that.
Now, what about anything with vision and dental that they need to investigate?
That is one of the advantages of Medicare Advantage plans. They can, the government allows them to expand their benefits. They're required to cover what Medicare covers, but then they can add vision and dental, and you'll see some with gyms and exercise programs. And typically they don't cost very much for the plan, so they offer them, and that's an added benefit. So if that's attractive to you, that would be something you can look at as an advantage with those plans.
And you're really looking at then your total care, not just the medical component of it, but looking at the eye, the dental, and then even maybe some prevention there, you said, with the gym. So looking at your personal health, talking about that maybe with your healthcare provider and making sure that they're covered, and then also checking the pharmacy formulary where they get their medications filled, correct?
Correct. I think a good way to start is with your primary care physician next time you're in, to ask them what, they usually typically keep a list of your drugs. You can ask them what Medicare Advantage plans, if any, they participate in, and that's a good way to get it started, because they may also give you some advice on what they accept and don't accept.
And they're pretty much in, I hate to say, a short window. I mean, time flies by pretty fast. This all needs to be done before December. Is that correct?
Correct. It's by December 7th of this year. You have to make a decision, and then the rest of the year, it's called a dark period where they actually have to get everything loaded so it's proper around January 1st.
Now, we've covered a lot of information. What's a good website that they could go to as far as some resources? Well,
you know, if you go to one of the commercial websites, they're obviously trying to sell you their plan. So I would really advise you going to Medicare.gov. It's the government's website. They're impartial. They're just giving you the facts. They're not going to try to sway you. They're just going to tell you what to search for, what questions to ask, and I think that's a good source for this information.
And I think that's the best part, Vincent, that you just said. Ask questions. Don't be afraid to ask questions, and then hopefully someone's out there to help answer those questions, whether it be the pharmacist, the primary care physician, going to that website to get more information, because this is important. I mean, you need to have this. And do they do it on an annual basis?
You can choose to change plans or go back to traditional Medicare every year. So this is the time you want to research and make a decision. It is a big decision. It can have some financial implications, so that's why you don't want to take it lightly. You don't want to just make a quick decision. You want to talk to maybe some family or your physician, your primary care physician, and take your time.
And then again, I think you pointed out too that word network, and that's making sure if you're going to your primary care physician, they refer you to another physician, and or maybe even have a hospitalization. You want to make sure that they're covered in that network.
Correct.
And so those are important questions. Vincent, we really appreciate you being here with us today, and hope that our viewers go to this website, which again is Medicare.gov, and look at your options right now and take advantage of learning a little bit more about Medicare Advantage.
Thank you for having me.
For more information, we encourage you to go to our website at www.hmh.net. Again, thank you for joining us this episode, and we hope you tune in next month for another important edition of Health in the Heartland.